I'm Jeff, I'm the Director of Insight here, and it's my great pleasure to welcome Dr. Kate Hall, Clinical Psychologist from YSAS and Deakin, here to talk about the ERIC tool. Before we move on, I would like to acknowledge the traditional owners on which we're gathered and are learning here today, and pay my respects to their elders past, present and emerging. Welcome to our real life guest audience, welcome to anyone here on telehealth, and to our guests on the webinar program. But without further ado, I'd like to hand over to Kate. Thank you to keep talking about emotional regulation and impulse control.
As Jeff said, I'm a clinical psychologist. I practice in Melbourne in a partnership role between Deakin University and YSAS, which is a youth specialist AOD treatment service. We've got 14 sites around Victoria where we provide specialist treatment, both inpatient, outpatient and outreach, to young people experiencing multiple and complex needs, I guess is the way that we describe them. In that partnership role, Deakin and YSAS have funded the development of this intervention, ERIC, which is a skills-based intervention for young people. And we've been in the process of developing this intervention for about 12 months. And this morning I'm going to talk to you a little bit about the rationale for why we developed it, what point we're at in our development, and then give a bit of a sneak peek of some of the resources that we've ended up with after this journey of development. Firstly, I'd just like to acknowledge some of my collaborators. So ERIC is co-authored by Dr. Angela Simpson. She's a health psychologist with extensive treatment experience in addiction. We use that term addiction within academia without really needing to, I guess in some ways, qualify that we're not discussing people with substance use disorders. It's really just a broad term to encapsulate the area of research in drugs and alcohol. So forgive me if I keep using it. It's one of our research priorities at Deakin University. I know it's got connotations that are problematic. Then the other team acknowledgements there are a nice easy mix of both academic staff and practitioners between both institutions. So it's been an enormous effort to get ERIC to the point that it is now that I'll be talking to you about today. The rationale for ERIC and why we developed it is very straightforward. Basically, YSAS have identified that the delivery of treatment to young people is something that, although based around enormous care planning principles, based around resilience models and frameworks, based around client-centred or person-centred care, we do have a gap in our youth-focused treatment services around evidence-based practices, mainly from a psychological perspective. And what we did was look at this current list of empirically supported treatments for what is termed comorbidity, but really we're looking at young people who seek treatment services who have mental health and substance use issues. And as you can see, the list is enormous, and in most cases these treatments are just for singular presentations. So there's empirically supported treatments for just some areas of anxiety. There are some for alcohol, there are some for cannabis. However, the young people that we see obviously present with multiple presentations, and they are polysubstance users as well. So what we've got is a bit of a breach between the academic evidence base about what we know changes behaviour and has good outcomes from a psychological point of view, and then what we can actually realistically, pragmatically implement in practice. And some of those assumptions are things like young people will attend services 1 hour a week for a counselling intervention. Many of these empirically supported treatments are a minimum of 12 to 24 sessions. A lot of them are group-based. They also require a sort of sequential skill building, so that if you haven't attended the week before, you miss out on core elements that is built upon in the week after. They also require young people being able to override frustration, override chaos in order to stay in a 90-minute session, for example, whilst these skills are being taught or whilst they're being learned. And for the young people that we see, already you can see that there's not equitable access to this type of treatment option for our young people because they're not really able to commit to that type of regular appointment scheduling. They want to interact on their own terms and flexibly with their service providers. Because of the multiple and complex needs that they present with, that they have chaotic lifestyles that are at different points. And so already there's this gap, I guess, between what we know works within a research context, what we know has a strong evidence base, and what we can apply in practice. The translation of evidence-based treatments into practice is what Eric is really trying to do. So we've taken a unique approach in the development of Eric that's been informed very much by the implementation science, that middle section of how to address the gap between research and practice. And the reason why we've done that because is ultimately what we want with something like Eric and any other intervention that we develop is that young people receive it and that they benefit from it, rather than it's a fantastic manualised treatment that's disseminated through needing to buy a manual, which is never really then filtered down and translated and then incorporated into day-to-day practice. So that in many respects what young people would really benefit from, we're hoping that we've overcome some of those barriers in terms of implementation so that they receive some of the skills that we've identified might help. So obviously trauma, anxiety, depression, disordered eating and self-harm are incredibly common in the young people seeking help for substance use within the sector that I work in, and I imagine it's exactly the same here in Queensland. Also, substance use is polysubstance use, and it's usually complex as well in its presentation. And I think that just the complexity of that picture means that it's quite difficult for us to find ways to intervene in a systematic way. So this is a little analogy that we use in that these are our current empirically supported treatments, and they're very neat and they're very well-founded in our efficacy research trials. However, not everybody really meets criteria, nor would they walk into these type of treatments. What we've done with Eric is try to create something that's very flexible, that's very modular, and which has deconstructed many of these treatments down to just processes that have strong empirical support. So we're informed very much by the evidence-based literature, but equally we're informed by the translational science literature that tells us that realistically anything that is not going to be able to be flexibly delivered in a very short interaction with a young person that captures just one moment or one teachable moment or one moment of intervention, anything that doesn't meet that criteria is probably not realistically going to be able to be implemented with most young people in frontline treatment services. So Eric has deconstructed many of these treatments. It's not a brand new treatment. There aren't magical elements of it that have not previously been established as being effective. It takes all of those processes that we know work very well and deconstructs them down into some modular moment that will be easily used within the field, so that then we trust that workers will be able to use each of those modular moments to build whatever they need to build with a young person that addresses their unique individual needs. That's just something random about Lego there. Okay, so what we ended up with after considering this process was firstly a transdiagnostic approach, meaning that we weren't categorising young people based on different diagnoses across different groups that really identify how people differ rather than how they are similar in their needs. And so we really wanted to address any psychological problems based on the underlying mechanisms for all difficulties, rather than just, for example, an anxiety disorder, a cannabis use issue and a depressive episode. In that way, we thought if we could break it down into underlying mechanisms, we would hopefully be able to be transdiagnostic truly, and and because of that, it's a much more pragmatic way of addressing some of the barriers to translation. So we ended up with ERIC, which really just stands for Emotion Regulation and Impulse Control. And we identified emotion regulation as one of these core transdiagnostic mechanisms that underpin so many mental health issues and also substance use disorder. Difficulties with emotion regulation have been identified as a really core mechanism in many anxiety, depressive and eating disorders. It's certainly something that is a core characteristic of personality disorder, mainly borderline personality disorder. It's something that goes awry if you have an early childhood experience of trauma or an invalidating environment. And impulse control, we know, is something that has a particular relationship with substance use disorders. So we know that the type of impulse control difficulties that might make you vulnerable to the development of a substance use disorder also then contribute to the perpetuation of that substance use issue. Then we also know that drugs themselves and alcohol interfere with our neurochemical functioning and the way our brains operate in order to create impulse control difficulties as well. So these two core areas were identified as potential transdiagnostic mechanisms that we could address in a translatable treatment package. And our working title was ERIC just because of the acronym, but it just kind of stuck because once we started talking about these two concepts with young people, they started to conjure up this idea in their head of a person called Eric. So we just kind of kept the name Eric after a while. And we're not that creative, so. So just back on that idea of emotion regulation, of actually what it is. It's a construct which is really multifaceted and it's spoken about a lot in the empirical and theoretical literature. It's certainly a given in clinical practice as well. We know that implicitly this is what we're trying to address when we're doing, when we're reassuring or trying to teach young people self-soothing techniques, for example. But in ERIC, it's a skills training package, so it's quite targeted. And we're very overt about the terminology when we're working with young people, and the piloting process has taught us that young people are very psychologically minded and they really want to know what exactly it is that they are learning and what they're doing. And they're quite discerning consumers of health information. And so we use appropriate language. We call it emotion regulation skills training. So emotion regulation in the theoretical literature is, as I said, multifaceted, but these concepts cover off most of it. Basically, the first idea is just allowing and accepting emotional responses without trying to change them. This is a theoretical understanding of emotion regulation taken from Gratz and Rometer's model, which is quite clinically applicable. And it's also using effective strategies when distressed. That's a given. In terms of emotion regulation, inhibiting unhelpful impulsive behaviours in response to strong emotions was something that certainly from my clinical background is one of the core features of emotion regulation. Being able to override mood in order to make a decision that aligns with future values or goals seems to be the real issue that young people struggle with. They have all the insight and knowledge if they've really engaged in a treatment process, but putting that into practice actually takes a lot of skill. And being able to override mood in order to stand back, consider options, take one moment to choose how you respond to a distressing event is just an incredibly complicated skill to learn. And throughout ERIC we use a lot of analogies around practicing emotion regulation skills being similar to learning complex skills such as a sporting skill, being able to play a sport, being able to play a musical instrument. And acquiring these skills takes years of practice, coaching, trial and error, personally observing how you did the behaviour in order to then mindfully respond in a different way next time. It's not about just understanding, it's about a lot of coaching and practicing and a lot of feedback from your environment or a trusted individual to help you learn these skills. Finally, the last one is really just being able to calm yourself down once you've been upset, and so self-soothing is a core part of emotional regulation. If a young person has an early experience of parenting that's not very attuned to their needs, that might be a traumatic environment or an invalidating environment in which they grow up in, the ability to self-soothe or calm yourself down is incredibly impaired, because it's something that you learn from a very, very early age from caregivers. So this is something that, even in terms of the young people I work with, a lot of my clinical practice has been in comorbid borderline personality disorder and substance use disorders. And this is a feature that, on day one of being distressed and emotionally aroused, a lot of the young people we work with can put in place the skills that they know are helpful and that will be helpful in the long term rather than just alleviate their distress. On day two, they start getting fatigued. Day three of still being distressed and emotionally aroused usually is when there tends to be, that willpower fatigue, where they then start succumbing to poor decision making or impulsive reactions to feeling overwhelmed emotionally. And even though we might teach young people ways of responding in the moment to the distressing event, we might sit with them in a room and reassure them. Once they leave, there's usually a degree of physiological arousal, there's usually a degree of emotional distress that carries with them for, can be days afterwards. So just giving young people very concrete strategies and tools to calm down was something that was one of the core areas of feedback with the young people we piloted Eric with as being incredibly useful. Okay, so impulse control, as I've said, is likewise a multifaceted construct. It's not something that we understand as this one behaviour, impulsive behaviour. Obviously the tendency to act when experiencing negative emotions within the impulsivity literature is characterised as this notion of urgency. One of the hardest things about this, to be honest, is that both areas of the literature in this space are just incredibly separate. It doesn't seem to be an area in academia that overlaps incredibly, and we know the transaction between these two constructs is incredibly relevant in a clinical and practical sense. But from a research point of view, it's not something that is overlapped incredibly clearly within the empirical literature. So we've kind of just bundled them in together, hoping that through our examination of both of these processes that we'll be able to contribute to the empirical literature in some way of understanding how they interact, how impulsivity and emotional regulation distress interact. The interesting one for me around impulse control is a lack of perseverance, the ability to override boredom, the ability to pursue a meaningful goal in spite of a mood, in spite of being irritable or in spite of being bored. And the one we all know very well is just, that impulsive act where the consequences aren't really considered until afterwards. And with young people, that's relatively developmentally appropriate to be learning how to connect an impulsive act with then consequences. And so Eric has a strong focus on decision-making skills and problem-solving skills that really try to engage that part of the brain that's really anticipating what things will be like in the future in order to make a good choice about now. So that's the sort of background from a theoretical and empirical point of view. It's a bit dry. I like it. Anyway, thank God, otherwise this would be a long, arduous process. But the aims for Eric, basically, as I outlined, are that they're translatable to our setting, and we want something that's pragmatic and useful. We want to add to our outcome literature, but that's not our driving force behind it. And we really wanted to emphasise this iterative process of development. We wanted to interact with the workers and the service providers primarily who would be delivering Eric in order to design a tool that was useful and that was meaningful to them. If the tools were liked by young people, that was really only half the battle. We really needed to develop something that workers could implement in the way that they worked, rather than us imposing how we thought it should be delivered on their practice. So this was our aim for ERIC. We went through a really long process, which I guess I've sort of outlined now, looking at both the evidence base, piloting with young people, the actual resources themselves, doing a lot of close partnering with workers. We have had a terrific relationship with one of the YSAS pilot sites, which is our residential rehab bureau in Victoria. Both the workers and the young people at that site have given us an enormous amount of feedback on all of the resources and how our package of work is to be delivered. We've actually listened to them. I know that sounds a bit silly, but in many research and practice relationships, it's realistically something where opinions are sought, but you don't really know where it goes and how it's implemented. So we've really invested in then returning to Birribee as frequently as possible, and then showing the young people who've given us feedback on a resource about how their changes have been incorporated. And our pilot residents, I guess, have got such a kick out of seeing that their suggestion about why that task was incredibly boring, which a lot of them were initially, why that task was incredibly boring was then taken on by us and then changed quickly. I mean, the problem with a lot of research is it takes an enormous amount of time, but we were very responsive and we tried very hard to respond quickly to feedback, and then we would show them the tangible outcome of their feedback. We also paid them for their time, so we valued their input in as many ways as we possibly could, so that we got meaningful input from young people. Now we're in the process of doing a broader implementation pilot, which has been funded through the Helen McPherson Smith Trust in Victoria. It's targeting regional Victorian youth AOD sites. And again, our primary stakeholder in this is workers, and we're doing a training and implementation study. We're also measuring client outcomes. However, realistically, we're trying to develop and pilot a really good training and coaching model for workers to ensure that not only do we have relevant resources for them, but that we know the best way to support workers in implementing them. So that's been our process. I'm going to skip ahead here, sorry about everybody online, but I am going on a bit. So what we ended up with was a worldview of ERIC, as well as a package of worksheets that are deliverable to young people, and a broad sort of, conceptual background to ERIC, which covers 8 different domains. I'll talk about the 8 domains in a little bit, but first off, I'll just, orientate you to the ERIC worldview. The first thing about a worldview is just that it's almost like these need to be absolute assumptions that you have prior to implementing any kind of worksheet or treatment notion. Because anybody can deliver a worksheet, anybody can actually just do them online now, and you can just download your own worksheet. There's so many apps out there which are emulating evidence-based psychological principles. A lot of ERIC is based on the mindfulness-based cognitive therapy literature, and there's an enormous number of mindfulness meditation apps out there. Are you allowed to swear? I just need you can, great. Because one of the things that we had in our most recent focus group was feedback from workers that even though they try to use technology alongside working with young people, the number of apps out there are actually quite shit, really. So we just call them SHAPs because they're just abstract. They don't integrate in a meaningful way into practice. And as far as the workers were concerned, that there's just overload of resources out there, and the feedback we've got so far about ERIC is that it's simple, it doesn't try to be too clever, and it's all in the one spot. And so in some ways that's sort of the best feedback that we could hope for. We don't want feedback saying this is the cleverest thing we've ever seen. We want feedback saying it's simple and it's all in the one spot, so we know where to go if we need things. So the ERIC mindset is really important because it actually starts orientating workers to a way of working. The worksheets are a bonus, but we are looking at whether workers adhere to the ERIC mindset just as much as whether they deliver a couple of worksheets. The first one is that there's hope for change, and this really comes from the idea that emotion regulation skills are learnt just like other skills. You're not born with terrific emotion regulation. It's not a personality feature. Everyone has different temperaments, and so you might have to learn different emotion regulation strategies to ameliorate some of the vulnerabilities of your temperament, for example. But realistically, no one has emotion regulation skills unless they've actively practiced them and trialled them. And this is very important in terms of the ERIC worldview. The next thing is that ERIC is not about using good strategies versus stop using bad strategies. ERIC is about cultivating flexibility in responses so that you have a repertoire of emotion regulation skills available to you that you can choose from, whilst acknowledging that occasionally we all choose the one that is rather unhelpful. The only thing that we're trying to avoid is ensuring that young people are not unable to choose, that they don't have any other choice other than that one way of responding, which creates that cycle of, for example, responding aggressively even when feeling distressed or rejected and needing comfort, responding aggressively, which then results in breaking connections with others, which then further results in distress. So we know that responding aggressively is one of the things that young people will do. However, we're hopeful that with ERIC, we're teaching skills in other ways of responding as well so that you do have flexibility. We looked at things like just young people wanting to be aware of their choices rather than just automatically responding to a situation, and that was very important to them. That sense that they could still choose to respond in ways that we thought might be unhelpful, but that they had other options as well. Just in our ERIC resources, we've captured that using a pyramid of strategies for managing emotions, just acknowledging that there will be sometimes strategies and then there'll be often strategies. And if you use the often strategies more than the sometimes strategies, then we think that's a pretty good outcome. These are not unrealistic outcomes at all. The often strategies are things like decision making, which is problem solving skills, flexible thinking, which is one of the ERIC domains, which targets being able to reappraise a situation and seeing it from different perspectives, mindfulness skills, a bit of self-compassion, self-soothing, and allowing an emotion to be without trying to immediately avoid it or push it away. Although we know that the sometimes strategies work really, really well at times, and at times they're kind of appropriate too. So even though I might be freaking out now about being like recorded or whatever, I can just suppress that for now, and then I might just have a little bit of a freak out about it later. It's appropriate to be able to suppress emotion in a particular moment in order for you to get through what you need to do. So even though suppression as such is a maladaptive emotion regulation strategy, and in the literature it's identified as being particularly associated with psychopathology, we know that on occasion a young person is going to need to suppress an automatic response in order to stay in line at Centrelink and wait for their turn, for example. So these are sometimes and often strategies, in the way that we've constructed those is basically relatively pragmatic and realistic. The other side of ERIC is that it's targeted skills training. We've got an idea that if it's not targeted, if the young person doesn't know what they're practicing, it's probably not going to change. And this is quite different to counselling. So counselling is something that is absolutely necessary in terms of establishing really good therapeutic rapport, establishing a collaborative relationship with a young person. But ERIC's quite different to that. ERIC probably will not work at all if you don't have those core skills. Some of the information around dialectical behavioural therapy treatment indicates that targeted skills training does work even if you don't have a good relationship, but I presume most of the young people we work with would require that as a necessary mechanism for change. But it's not sufficient to then acquire skills in emotion regulation or impulse control. So we're looking at making sure that the young people are actually aware of the skill that they're learning and that they're practicing. And that's why we've given them names, we've given them icons, we've given them colours, we've given them anything that we can. We've created a story around each strategy so they can remember the rationale for why avoidance is, good for the short term but not good for the long term. And so that they are also on board with the strategy that they're learning, and they can come back to their worker and have a discussion around whether it worked or whether it didn't. The different targets in ERIC, one of the things a lot of our workers wanted to know was if they only had a brief period of time with a young person, what they should do first. Because a lot of empirically supported treatments are very, very long. They have multiple sessions and multiple targets. DBT is a really good example, and a lot of ERIC stuff is derived from the DBT literature. DBT is enormous to wade through, and you have to be incredibly sort of committed yourself in some respects to learn that type of treatment or therapy. Acceptance and commitment therapy is incredibly complicated in terms of the theoretical underpinnings of it. Mindfulness-based cognitive therapy, likewise, is a session-by-session manualised training package that builds from session 1 right the way through till your end sessions. So our workers wanted to know if they only had 10 minutes with a young person, what they should do first. And we didn't know. And usually what happens in that situation is that we make decisions based on our clinical intuition. We make decisions based on our past experience with young people who had similar presentations, and we use this practice wisdom to guide our decision making about what we should target first. And all this is incredibly valid, but we wanted to augment that with evidence-based practice as well. And we found basically this terrific mirror analysis which helped us then identify if you only had a small amount of time with someone, what you should do, you should target avoidance, rumination, suppression and problem solving, because these domains or these concepts have incredibly robust and large effect sizes when looking at their relationship to psychopathology. So we created a domain called Reducing Vulnerability, which was exactly that. If you really do nothing else, just target those maladaptive strategies. When we piloted this with the young people, we originally thought that they would need a lot of rationale and encouragement about why emotional regulation strategies would be useful. And they didn't find that useful at all. They found it to be just time wasting. They were irritated by it. They were the worksheets and the ERIC processes that they were most frustrated by and gave us the most feedback on needing to change. We had rationales in there about, if you develop good emotional regulation skills, then your relationships, will be more positive. You'll be able to resolve conflict better. You'll be able to achieve goals, and all of that sort of jazz. Now, the young people were identifying that as a given. They already knew that. Emotion regulation for them, once we described what it was, they identified immediately as something they found valuable as a skill to learn. So in terms of then why you should learn it, we jumped straight into what you should do based on their feedback, saying, look, we know that it's important, just tell us what we need to do. And we give, as I said, some of the strategies, their theoretical name, and rumination was the one that they really, really latched onto, and it captured their attention enormously because they spend an enormous amount of time ruminating, basically. And so we usually now just jump straight in with stopping rumination and what strategies you might use to do that. And once we have done that, young people can see that these resources are helpful, rather than trying to convince them that they're helpful through a strong rationale of what they might benefit from. And so this is just an example of our first piloted resource around interrupting rumination. And because we were piloting this in a residential service, there then was a collective language amongst the young people around the ERIC strategies. And the 54321 method then started appearing on their discharge summaries. 54321 started appearing on, their daily plan of what they might do. If they were involved in a situation with someone, they might then be reminded by a fellow resident to practice 54321. The main application of it we found was before going to bed, and you know, realistically needing to prevent that that rumination that occurs prior to falling asleep. And the analogy we use within this particular worksheet really resonated with young people. It's the idea that, taken from acceptance and commitment therapy and other mindfulness-based therapies, that your mind is time travelling, and that it travels to the future and it travels to the past. And they really got that. They got that idea that their mind spent a lot of time worrying about what could go wrong in the future. Their mind spent a lot of time remembering things in the past that were not particularly pleasant. They knew immediately that that was not their life experience in its entirety, but that their time-travelling mind almost on purpose went to things that were not necessarily very nice. And so the 54321 method is as simple as that, that little rationale that you want to be able to bring your mind back to the present rather than at time travelling. And that it's really just a muscle that you build with skill building, and 54321 helps you do that. It's a simple grounding exercise, and they'd heard of grounding, but they never really understood why you would use it, and they didn't really understand the rationale for what it would do and whether it was linked to rumination. So we kind of pitch this stuff quite high with young people. We use analogy and story to make it relevant, but we're not saying trust us, just do 54321. We're giving them the science behind it, and we're giving them the reason as to why it might be useful, and then they chose whether that was useful or not. This was the most useful strategy for them. Naming 5 things that they can see right now, 5 things that they can hear, 4 things they can hear, 3 things that they can feel, etc., etc. Because a lot of the young people did have quite significant trauma backgrounds, we worked out pretty quickly that 54321 wasn't enough, and that they would have to repeat that maybe 2 or 3 times. And in a manualised intervention, that's not necessarily articulated as clearly as that, and we didn't even really think of it, to be honest. It wasn't until the young people gave us feedback. One young person was saying, you know, look, it was my 21st birthday, I'm in rehab, my boyfriend's in jail, you know, like everything's pretty crap at the moment, to be honest. And I tried that 54321, I still felt pretty shit. And we were like, well, obviously it's not going to make everything better, but it's going to be something that is just one small strategy or skill that will bring your attention back to here to give you some relief from some of those thoughts. So we had to sort of articulate you know, their expectations of how some of their strategies may or may not work pretty clearly in the worksheets as well. Facing up to avoidance is a big one. We know that that's probably one of the most maladaptive ways of maintaining sort of you know, difficult emotional or physical sensations or memories is through avoidance. And this is a really standard cognitive behaviourally driven exposure task, but instead of the complexity of some of those tasks around exposure therapy, which have great evidence for being effective, particularly in the areas of anxiety, we've simplified it dramatically and then given the young people the coping thoughts that they need at the time to get through the task. What we found from the piloting is that sometimes we would assume that they might be able to generate coping thoughts themselves in order to get through the task, and we worked out pretty quickly that that wasn't always the case. And so that was one of the contingencies that we built into some of these exercises, of actually giving young people the thoughts to remind themselves of in order for them to just get through it. Some of the coping thoughts that they generated for us is just that simple notion of being through a lot worse than this before, and that seemed to be the coping thought that was most meaningful to them. Another ERIC worldview is just really that it's an acceptance-based intervention, like most modern cognitive behavioural therapy packages. And this really was, you know, an incredibly difficult concept to describe, and realistically most of the doctoral candidates in clinical psychology that I lecture to still don't really understand it. And they do an enormous amount of theoretical kind of learning on this notion of acceptance, on cognitive behavioural treatments. But it's almost impossible to describe in simple terms because on the face of it, it's bizarre to say that everything is really, really difficult and you need to accept that. And that if you accept it, you'll feel better. It just doesn't make sense to describe it in that way. So instead we came up with, this sort of notion of a balance between acceptance and problem-solving approaches. This is very strongly derived from dialectical behavioural therapies, but then simplified dramatically for translation. So we know that at times you want to be able to latch onto problem-solving strategies, which in one sense are not accepting, that's actually solving. But in some circumstances you also need to flexibly accept that there's nothing that can be solved, that this is just difficult and this is uncomfortable, and to accept that. And that the strategies in this acceptance and change kind of balance are really just being able to watch the cues of the young person, respond flexibly from a worker's point of view. Acceptance is embodied in validation in a counselling kind of style. It's the validation of a young person's experience. But if that's all that occurs, validation, then the change doesn't happen as well. If all you do is insist on change and jump in with problem solving, then young people seek validation and they resist change. And motivational interviewing is basically designed around this core ambivalence of wanting to change and not wanting to change. But again, it's incredibly complicated. So we've just simplified that whole rolling with resistance, simplified that whole transactional nature of change, that step-by-step process that MI articulates, into this seesaw of just whether you validate or problem solve. And it just seems to be a lot easier to be able to disseminate that, although the principles are the same. For young people, we then realise that that's absolutely irrelevant. They have no idea what validation is, and it's not meaningful to them. They know problem solving, but then this kind of higher order theoretical construct of a therapeutic relationship balance is irrelevant. So we came up with an analogy basically which is used in a lot of acceptance-based treatments, mainly acceptance and commitment therapy, in order to try to describe what acceptance is. And realistically, this analogy is something that you may have heard before, but we described for young people the idea that their life is really a road trip, that they are on this road trip driving in a minivan, and that the passengers on the minivan or in the minivan with them represented all manner of internal stimuli like bodily sensations, cognitions, emotional content, and that we tried to articulate that the passengers in that minivan were things like an overly critical passenger, someone that tells them just how shit they are. There was other passengers in the minivan which are the thoughts that remind them of really difficult past memories. There are any number of passengers on this minivan, and then what we articulate is that however they themselves are the driver, that they are driving the minivan, and that these experiences are passengers. And then we basically articulate with them a lot of different rules of what this road trip of life is about. And the first rule is if you're driving and you pull over on the side of the road in order to try to wrestle with all of these horrible passengers on your bus, they will never leave. But the problem is that now you're stopped and you're not going anywhere meaningful, and you're certainly not headed in the directions that you would want to in life. And you're expending an enormous amount of energy wrestling with these passengers on the bus that you're trying to kick off the bus. And so they will be there, that is a truth, however you can choose to continue on your journey. And that seemed to kind of represent acceptance realistically, that you can't get rid of horrible things that have happened to you in the past. The only thing is, another analogy we gave them is that if you let them drive, if you let them take over the wheel of your minivan, generally speaking, you'll end up going somewhere where you don't really want to go. Likewise, if you listen to them and they give you directions, you'll probably get lost. And this sort of analogy sort of just kept building throughout our interactions with young people, and we wrote them down and represented them in this way. And it seemed the simplest way to communicate the rather difficult concept of accepting difficult thoughts, feelings, memories and body sensations in order to continue to travel in a meaningful direction. ERIC is based on learning theory, basically, meaning that if a behaviour is reinforced, it will be maintained, and that's why there's a big focus on addressing avoidance in ERIC. And we also have a really strong worldview around all emotions having a function, and this is something that's derived from the compassion-focused therapy literature, which is looking at all the different emotion regulation systems and articulated by Paul Gilbert in his description of this intervention. And it's a simple concept that in actual fact the young people really responded to well, that your emotions are there for a reason. And in Paul Gilbert's description, he derives it from evolutionary psychology to articulate with enormous meaning why some of these emotions are there, and that fear is absolutely essential for survival, and anger is absolutely essential for protection, and shame is absolutely essential in order to remind us when we have transgressed against our social norms. And if we transgress against social norms, then we're at risk of being rejected by our tribe. If we're rejected by our tribe, then our life is at risk from an evolutionary perspective, because we're not then protected by the collective group of people around us. And so, as horrible as shame feels, it's there for a reason, and it's important. And in this sense, we try to sort of articulate with young people that emotional literacy is one of our domains, and that being able to differentiate between what is shame, what is fear, what is anger, fundamentally requires just that idea that emotions are important and they're not to be avoided and they're not to be pushed away, and they don't serve a function that's helpful at all times, but being able to read the signals is incredibly important in emotion regulation strategies. So we described emotions as an inbuilt alarm system, and that in actual fact they're there for a purpose. And if you develop skills in noticing emotions, then you can articulate what they might be telling you. And they might be telling you nothing. It might not match your circumstances whatsoever. And you can do a reality check and see if that emotion fits. And then you can choose how to respond, or you can look at your emotional experience and say, yeah, it does fit this situation. I am at risk. I need to get out of here. I need to listen to these fear responses. And this was another thing that was really prophetic for the young people, because they've spent so many of their early years without noticing emotional content, usually due to substance use. Even when not using substances, they weren't particularly observant of emotional experiences, and so they have a hypersensitivity to kind of feelings and emotions, and then an automatic response to try to avoid that experience. Even positive emotions can be very uncomfortable, and we didn't really factor that in until we had feedback from young people that some of the most significant emotions that they avoid are hope that things will get better in the future, or just the idea that that they can wish that they'll feel some kind of pleasure. So in some respects, we kind of just had to embrace all of that feedback, although the target of ERIC is really those uncomfortable emotions. We've incorporated in some of the stuff in the resources about that some positive emotions are actually, like euphoria and joy, are actually dangerous as well. They might be telling you some interesting information. They can give you some signals that you need to listen to as well. Okay, finally, I think the ERIC worldview is based around cognitive therapy, and that's that really straightforward notion that how you interpret a situation dictates how you feel. And so a lot of the ERIC resources draw upon that of, in many respects, teaching young people to dissect what's a thought from what's a feeling from a body sensation, and this is just throughout the whole of the package. This dissecting your feelings is a practiced skill, but it's just repeated throughout the entire package of being able to differentiate thinking from feeling and body sensations. Okay, so that's our worldview, and I've gone through the development of ERIC at length.
That's good.
5 more? No?
You've got
Finish
5
up?
more, or a couple of time for questions.
Okay.
Yeah.
So I guess the last thing I want to do, if that's okay, in 5 minutes, is just to give you a summary of the 8 domains. I guess I've taken you through a long-winded way of how we've arrived at them. And in some respects, just give you a sense of how they have been articulated in terms of outcomes for young people rather than meaningless theoretical constructs. So these are our 8 ERIC domains. The first one I've already run through, which is reducing vulnerability to emotion dysregulation and impulse control. And basically that's that notion of addressing maladaptive strategies first. The second one is emotional literacy, and the theoretical underpinnings of that realistically are that notion of emotional clarity. Emotional clarity is a construct which has been studied a lot in relation to developmental disorders in young people, as in autism spectrum disorders, but also in eating disorders and substance use disorders. And it's the ability to not just name an emotion, but also differentiate between the different sort of shades of emotions in some respects. And we see it in many respects as a gateway skill. So coming back to that original question, if I do nothing else with a young person, what should I do? We figured those 2 are a pretty good start, to be honest, and the rest if you get a chance for that, but if you don't, no sweat. Flexible thinking is something that's really based around the theoretical construct of cognitive reappraisal, which is looking at, that's just that basis of cognitive therapy interventions, which is looking at training people to see things from more than one perspective. As the young people who we worked with said, just basically putting myself in someone else's shoes, and that's really all it is. However, it's quite a complicated cognitive task to be able to stand back from yourself, put yourself in someone else's shoes and look at the same situation from their perspective. And so what that means is that there's lots of training in being able to put yourself in other people's shoes, and we use something like an ambiguous picture in one of our exercises, and then asking people to generate like 4 alternative ways of really interpreting what's in that ambiguous picture so that they get that cognitive reappraisal. I've been through acceptance. We call it allowing just because acceptance just was, a too difficult concept for young people to grasp, and in the end we just called it allowing, letting it be, just allow it to be there, and that seemed to be more representative. Everyday mindfulness is a strong feature throughout ERIC. Mindfulness-based practices are obviously very well disseminated now and have got a good strong evidence base, and we've not tackled mindfulness meditation in this package at all. So the everyday mindfulness differentiates the mindfulness in ERIC from that contemplative practice, which is really sitting and meditating. Everyday mindfulness is realistically just small strategies that assist young people in not operating in automatic pilot and focusing their attention. Tolerating discomfort is something that sort of fits quite strongly with acceptance. In many respects, we just wanted a really strong focus on some coping skills that were very practical, that were quite pragmatic, that could be just used in order to tolerate the discomfort of some situations which are unavoidable and really difficult to problem solve and are very difficult to do anything about, and realistically it's the counterpoint to avoiding, it's just tolerating. But tolerating is really difficult if you don't have just core strategies to do that. Decision making is problem solving, and basically you would remember from the original empirical background, it's one of those strategies which is a bit unfashionable, but it's certainly an enormous amount of evidence for it being an effective emotion regulation strategy. And we also had an ERIC domain around image and identity, which on the basis of the feedback of our participants, we changed to just mean values and identity. because image brought up connotations around physical appearance. So we were thinking self-image, but realistically for them it was just their values, what they value, what's meaningful to them. And so, for example, back at the bus analogy, we talk about values as being the compass that is really guiding you in the direction, and that knowing your own values is helpful in decision making, but it's also helpful in overriding emotions. So there are our 8 domains. I might stop there and take some questions.
Yes. Excellent, thank you. And the first question from Webinar Land, and maybe from the floor as well, is where can people access these tools, Kate?
So the process at the moment is that because we're still evaluating Eric, that if you would like to partner with us in a pilot evaluation, we're really keen for Eric to be disseminated, and the only thing the only condition that we put on that is that we can measure it while we do implement it. So the Eric package and tools and strategies are not available for download to be implemented in any setting. But as Deakin and YSAS are incredibly keen to partner with any organisation that might want to implement ERIC in a systematic way so that we can then measure it, because we're still in a development phase.
The other question I had was, is there application, or what are your comments around applicability with family members and significant others?
I mean, it's amazing because it wasn't ever our focus, because we had a really clear idea that these were skills to cultivate in young people. But we soon worked out from feedback from workers who were parents themselves, feedback from even our funders who were parents, that they really wanted to know what these strategies and skills were so that they could use them with adolescents, but also they could use them themselves. And what we've done is incorporate in our evaluation, we're actually measuring our workers' emotion regulation skills and see whether they improve and change through learning the ERIC strategies and skills. Because realistically, not all of us are very good at all of these, and we all have, routine patterns of responding, which are pretty unhelpful. So we are actually measuring worker acquisition of ERIC skills and strategies, and we're measuring worker acquisition of acceptance and mindfulness-based skills. And we're really hopeful that we can then develop something that's more applicable to a parenting environment. Yeah.
I'm doing 5, 4, 3, 2, 1 before I get there tonight for shiz. Any questions from the floor? I think that's it. If you could all join me in thanking Dr. Kate Hall. An incredibly interesting presentation, and just have to chunk it up in such meaningful little bits and pieces is the real skill and art, and then packaging them all up. So congratulations on all that hard work and getting to that point.